Hello and welcome to this brief video explaining the record of clinical activity. This is from the Department of Family Medicine at RCSI Perdana, and I'm Professor Anthony Cummins. First of all, at this assignment, like all others, you should ensure that your student ID is on the sheet, your submission date, circle which rotation you're in, name your tutor here. Now, during your 5 weeks of clinical postings, you were required to carry out various skills and procedures as listed below. Please, on day 1 of your first posting, let your tutor know that you will require practice of these, as these will be assessed in your OSCE next summer. There are videos of these on Moodle to support your learning. So what you do with each clinical posting, for example in Clinic Kesehatan Cheras, HKL OPD, Clinic Kesehatan Sentul, Clinic Kesehatan Stabak, and your private GP posting, you will tick each time you master one of these skills. The first group are clinical examination skills. So the first 5 are clinical examination skills: cardiovascular, respiratory, abdominal, musculoskeletal, neurological. This includes central and peripheral nervous system. Now don't worry if you don't achieve all of these in week 1. Let's say you're in KK Cheras. You have 5 weeks. Over that period of time, you should have had ample opportunity to practice all of these skills. In addition to the clinical examination skills, there are also practical procedure skills, such as checking the pulse competently, checking the blood pressure, both with automatic and desktop non-automatic machines such as aneroid or other sphygmomanometers. You should be able to competently check the respiratory rate, take a temperature. You should be able to dipstick a urine sample and interpret the findings. You should be able to perform a urinary HCG test to decide if there's a pregnancy. You should be able to competently use an otoscope in order to examine the ears of a child or an adult. You should be able to assess visual acuity, visual fields, and pupil reactions to light. You should be able to perform fundoscopy. You should know how to calculate the BMI and to interpret it in the light of the person's overweight or obesity status, etc. You should be able to perform a peak flow rate competently, and this is often assessed in the OSCE, and also to interpret it in relation to a patient's height and age. You should be able to competently demonstrate to a patient, either adult or child, how to use a meter dose inhaler for asthma as well as a spacer. For type 2 or other diabetics, you should be able to demonstrate competently how to use a glucometer to check a random blood glucose. You should be able to perform venipuncture, intramuscular injections. You should be able to competently perform an ECG and also interpret it for any major abnormalities. You should be able to conduct an antenatal examination and assess baby weight. I've left this one till the end because I think it's probably more important than all the others. You should be able to obtain informed consent from a patient about a procedure that he or she is about to undergo. Now, each week of your clinical postings, when you achieve mastery of any of those skills, you tick the relevant box here. By the end of the 5 weeks, you will have this document completed. So in end of each week, on the Friday of each week, make sure you get the tutor's name here and the tutor's signature and date it each time. They will also be chopped by the tutor. They prefer to do that, and that's fine. If there are any skills you were unable to complete, you should itemize them here, list them here, and then in the box below, list the reasons why you were not able to perform them. It may be something simple as the clinical practice did not have an ECG machine, for example. And once all this has been signed and chopped, you then scan it with CAM scanner and upload it to Moodle before 5 p.m. on the Friday of week 7. That's October the 28th, 2016. Thank you.